A growing threat, the RSV wave sweeping across the U.S. The United States is currently facing a concerning rise in respiratory syncytial virus, RSV, cases, with recent data revealing an increase in hospitalizations among infants and toddlers. This surge comes at a critical time as the country enters the fall and winter respiratory virus season, typically associated with a higher prevalence of illnesses like COVID-19 and the flu. RSV, the leading cause of infant hospitalizations nationwide, poses a significant risk to the youngest members of our communities. Health experts emphasize the importance of vaccination for pregnant women near their delivery date, or immunizing newborns to mitigate this risk. The Los Angeles County Department of Public Health encourages individuals to get vaccinated for RSV, especially those who have not done so previously. The virus can spread through coughs, sneezes, and even by touching contaminated surfaces and then touching your face before washing your hands. Data from PopHive, a project led by the Yale School of Public Health, shows a notable increase in RSV-related emergency room visits among infants under 1 year old, rising from 0.4% to 1.2% in just 1 month. Epidemiologists Caitlin Jetelina and Hannah Toddy warn that an RSV wave is starting to take hold. RSV can be particularly dangerous for infants, older adults, and individuals with certain medical conditions, according to the U.S. Centers for Disease Control and Prevention, CDC. It can lead to pneumonia and a severe inflammation of the lungs' small airways, known as bronchiolitis. The CDC estimates that approximately 2% to 3% of young infants are hospitalized annually due to RSV. Most children hospitalized for acute respiratory disease caused by RSV were previously healthy, as per a study published in the journal Pediatrics. These children may require oxygen, intravenous fluids, or even ventilator support to aid their breathing. Unlike the flu and COVID-19, there are currently no antiviral drugs available to treat RSV once infection occurs. The combined activity of respiratory illnesses from RSV, flu, and COVID-19 is currently considered very low in California, according to state health officials. However, the LA County Department of Public Health notes that we are starting to see the beginnings of respiratory virus season. Health officials in Santa Clara County, the most populous in Northern California, are already reporting medium levels of RSV in the wastewater of San Jose, Palo Alto, and Sunnyvale. Dr. Regina Chincio Kwong, the Orange County Health Officer, emphasizes the importance of getting vaccinated now, especially before respiratory virus activity potentially increases later. RSV immunizations are recommended for pregnant women between 32 and 36 weeks of gestational age, as well as for individuals aged 75 and up and those aged 50 to 74 with underlying medical conditions. Vaccines are also recommended for individuals residing in nursing homes or long-term care facilities. If a pregnant woman hasn't been vaccinated against RSV, officials recommend immunizing her infant. RSV vaccinations are relatively new, introduced in 2023, with 3 brands now available: Moderna's Mresvia, Pfizer's Abrysvo, and GSK's Arexvy. All 3 can be used for older adults, but only the Pfizer vaccine is suitable for pregnant women. Infants can also receive immunization through monoclonal antibodies, which function similarly to vaccines. The arrival of RSV vaccines follows a challenging 2022 to 2023 respiratory virus season, when California experienced a triple-demic of RSV, flu, and COVID, straining hospital resources. Unlike RSV shots, flu and COVID vaccinations are generally recommended ahead of each fall and winter virus respiratory season. Older adults aged 65 and up can receive the COVID vaccination every 6 months, as per the California Department of Public Health. People can conveniently receive the RSV, flu, and COVID vaccinations during a single visit to a healthcare provider. Dr. Chin-Seo Kwong highlights that receiving all eligible vaccines at once is considered best practice, as it helps avoid scheduling challenges and missed opportunities. Annual routine flu vaccines are recommended for everyone aged 6 months and older. As for COVID, a vaccine is available to anyone who wants one. The California Department of Public Health specifically recommends the shots for individuals aged 65 and up, babies aged 6 months to 23 months, unvaccinated children and teenagers, and people with certain health risk factors and those in close contact with them. Pregnant women are also encouraged to get the COVID vaccination. After initial concerns about the availability of COVID vaccinations earlier this season, pharmacists and California health officials now report that securing the shots is relatively straightforward. The controversy surrounding COVID vaccinations arose during the late summer, amidst confusing guidance from agencies overseen by Health and Human Services Secretary Robert F. Kennedy, Jr., who has expressed skepticism towards vaccinations. There was a period when the Food and Drug Administration, FDA, belatedly approved COVID-19 vaccines only for those aged 65 and up and younger people with underlying health conditions. This unprecedented delay in the CDC issuing its own recommendations led to significant disruptions in vaccination efforts for many. In some states, people, including seniors, were turned away from receiving the COVID vaccine at their local pharmacy, even during a late summer surge. At one point, the CDC's Advisory Committee on Immunization Practices nearly recommended that the COVID vaccine be available by prescription only. On October 6th, Acting CDC Director Jim O'Neill officially lifted the agency's recommendation for adults under age 65 to get the updated COVID-19 vaccine, instead advocating for individual-based decision-making in consultation with health professionals. Now, patients can freely discuss the COVID-19 vaccine with professionals at their local pharmacy. California has also recently clarified state law to ensure that pharmacists can independently administer the COVID vaccination, as per Dr. Erica Pan, Director of the State Department of Public Health. Stay informed and take the necessary precautions to protect yourself and your loved ones during this respiratory virus season.